Greeting, ladies and gentlemen. My name is Pauline, and I'm the Vice Chairperson for IBC. It is my pleasure to welcome you to the 5 Minutes Healthcare, an initiative from the IBC Health Working Group. I would like to introduce Dr. Reginald Liew from Parkway Hospitals Singapore as our guest today. Dr. Reginald Liew is a Senior Consultant Cardiologist, and he will be answering a series of questions on heart health over the next few weeks. Stroke, high blood pressure, and cholesterol. How are all these linked to a heart disease?
Thank you, Pauline. That's a very good question. And in fact, there are all common problems that many of us may have, particularly as we get older or get more stress in our senior lives. All of these are important to pick up and diagnose and treat because they're all linked to heart disease. The stroke and heart attack and heart disease involve the same problems and risk factors. So when we talk about stroke, often it's because there's either a blood clot in the body that has traveled up to the brain and blocked a blood vessel in the brain, or there's a burst blood vessel in the brain because of very high blood pressure, or sometimes there's a bleed in the brain. All of these problems can be related to high blood pressure because high blood pressure increases risk of bleed or blood clots developing. But also people with cholesterol can increase deposits of cholesterol crystals in neck blood vessels that can sometimes break off and travel. The cholesterol crystals can travel up to the brain to cause a stroke. And of course, cholesterol itself and high blood pressure increase risk of blockages in the heart blood vessels, increase risk of heart attack and coronary artery disease. And so if one has a heart attack, that can weaken the heart muscle. It can lead to other arrhythmias, such as something called atrial fibrillation, which is a very common heart rhythm problem affecting us. And atrial fibrillation itself, because the heart beats fast and irregularly, can cause blood clots to develop inside the heart. These blood clots can then travel to the brain and cause a stroke. So a lot of complex and important interrelationships between stroke, high blood pressure, cholesterol, and heart attack. And the important thing to remember is that all of these are also have common risk factors. And if we can identify and treat these problems, including high blood pressure, high cholesterol, and diabetes and obesity, we can actually reduce the risk of stroke and heart attack. So important to pick up and correct.
Dr. Liew, thank you for explaining to us how stroke, high blood pressure, and cholesterol are linked to the heart disease.